How was your day? Welcome to the program tonight. So, this is a page that all I do is educate, educate, and educate. So, yesterday, we were able to talk about mouth odor, various causes of mouth odor, and of course, the ways out, how we can, remedy the situation if you're going through mouth odor. So, tonight, we want to go straight to body odor. And when you talk about body odor, it is not only when you don't have good personal hygiene motivations that you can have body odors. It can happen to anyone at any time, and we have several causes of body odor. So, talking about body odor, it can happen to women, it can happen to men, it can happen to boys, it can happen to girls. Like I said, there are various factors responsible for body odor. So now, what is body odor? Body odor is just like we said yesterday, that unpleasant mouth odor. We all have mouth odors. Now we all have body odors. You understand? But it is not all of us that have unpleasant body odor. So we have pleasant body odors, and of course, we have unpleasant body odor. So talking about body odor is just the odor that somebody can perceive, or you yourself can perceive in your body at a particular time, or somebody with you perceives, and they will say, "Oh, this is pleasant body odor. This is good body odor." So there are several ways to go about the remedies. But for now, we're not talking about the remedies. We want to go straight into the topic of the day, which is body odor. Body odor is just the odor that somebody can perceive from you, or you can perceive by yourself, and it can either be pleasant or unpleasant. Now, talking about body odors, let's begin to talk about the causes. We have various causes of body odor. The number one cause of body odor is sweat and bacteria. When you are sweating and you have not freshened up after a very stressful day or something, and maybe you have not freshened up, you have not had a shower, you have not had your bath, you have not done anything, you know, it will mix with the normal bacteria. There's something in our body that we call normal bacteria. We call them normal flora. And what are the cost? What are their functions? They are in almost every part of our body. And when we're talking about normal flora, we have in the mouth, we have in the nose, we have in the skull, we have on the skin, we have on the intestine, we have normal flora almost everywhere in our body system. Let me share the video so that people can join. So those normal bacteria, we call them normal flora in our body system. What do? Their main function is to prevent against outside bacteria that might want to enter our body, especially our skin. We have on the armpit, we have just all over the body parts, right? So if the sweat in our body and the bacteria in our body now mixes together, especially the outer part, what happens? There will be serious tension. That is body odor. There will be body odor. And of course, it can be as a result of improper hygiene or lack of proper hygiene. Maybe you've worked the whole day today and you've not taken your bath. Tomorrow, no bathing. Next tomorrow, no bathing. You are going for 2, 3, 4, 5 days without having a shower or a bath or something. You can come down with body odor. And of course, when we're talking about that, it still boils down, apart from the bath, it still boils down to your undies. If you are a lady, your bra, how neat are they? Your undies, your pants, your tights, how neat are they? If you are a man, what about your singlet, your briefs, your boxers? You understand? How neat are they? Are they properly uh, tidied up or cleaned up or washed? You understand? That is one of the many reasons for body odor. And of course, it can be as a result of some food or drink that are strong, that are too strong in nature. It can be like broccoli, it can be like garlic, you understand? A whole lot of things that you take that can cause body odor. And of course, it can be as a result of drinks like alcohol, you understand? Those are some of the things that can, cause body odor. And of course, it can be as a result of what we call hyperhidrosis. Hyperhidrosis simply means excessive sweating. You understand? Some people have don't sweat at all. Some people sweat normally. Some people have what we call hyperhidrosis. That is excessive sweating. So if you are sweating profusely, you are the type that is having that excessive sweating, you can come down with what we call body odor. And it's be as a result of exercise. When you do exercises, there is no how except it's not properly done. You will want to give up some sweat. And as you are giving up some sweat, it is possible for you to start experiencing body odor. And those are just temporary. They are not something that is permanent. It's just peculiar to that time that you are starting, that you are doing it. And of course, it can be as a result of hormonal changes in the body. You understand? Hormonal changes, something that is distorting the normal hormones, the way they are, in your body. But this time around, maybe there is something that is distorting them. As a result of that, you can come down with body odor. It can be as a result of hot weather. You know how it happens, why it rolls. During hot weather, everywhere is just hot. Hot, hot, hot. No two ways about that. So if there is hot weather, it's one of the things that can cause excessive sweating. And of course, apart from hot weather, most some people, I will not say most people, some people that are overweight or obese. When we're talking about obesity, we have three main types. We have the mild, the moderate, and the severe. We call it the morbid obesity. That is the one that has really affected someone's health. You understand? So for some people that are obese, they find it very difficult to tidy up their armpit, their groins. We'll be talking about the places that can smell, that are prone to smelling in our body system. And it can be as a result of that obesity, and you see people, most of them are lazy some of them are lazy to take care of themselves. Some are trying to, but because of, you know, the weight, they might not be able to clean up the way somebody that is not obese would clean up their own body. And of course, it can be as a result of some medications that you've been given. Maybe you are using some drugs, and that is even prescribed by the doctor. They are prescription drugs. Despite that, you still come down with what we call body odor. You understand? You are taking any drug and you find out that, oh, each time you take this drug, you are just sweating profusely, or you are smelling. Is, changing your body odor. You understand? It's something that you need to see your doctor about. There are some antibiotics that you take, and you, even when you pee, you notice that you start seeing, how do I say, you start seeing signs of, you start, perceiving some odors, or even in your body, you start, perceiving some body odors apart from in your pee. Do you understand? And of course, it can be as a result of some medical conditions. Like, for example, somebody that has diabetes can start noticing sweet odors. They can start, due to excess breakdown of ketones. You understand? And of course, it can be, if it is liver disease that somebody have, they start having uh, body odor, depending on the type. If it is active thyroid, there's something just within, inside there, we call it thyroid gland. And due to increased metabolism, somebody can start having body odors. And of course, it can be for to both male and female. It can be as a result of puberty. When we enter puberty, initially our body was just, doing its own thing. But when you enter puberty, there are a lot of hormones that have been inactive in your body system, and they become triggered, you know, as soon as you enter puberty, because they need to help you do one or two things. And when it happens like that, because you have entered puberty, you start noticing some odor. At times, they might not be pleasant to perceive. So you yourself might not even know that those things, the odors are just there. While it might be people around you that will first notice that, oh, this is not too good. You understand? It might be as a result of that. It might be as a result of gout. There's something we call gout arthritis. It's one of the things that can give us body odor. And of course, apart from that, it might be as a result of menstruation. That's women's period. At time when you are menstruating, there are a lot of hormones that comes into play when a woman or a girl is menstruating. It can, if you are not properly, uh, if you refuse to care for yourself very well during menstruation, you can come down with body odor, and even people around you will start perceiving and be noticing that, oh, this is not too fine. It can be as a result of vagina infections, like the yeast infection, the fungal infection of the vagina. You notice at times that if you are not properly taking care of your hygiene with that, you can come down with what we call body odor. So body odor has a lot of causes. And of course, it might be as a result of illegal drugs like marijuana. It can be as a result of marijuana, cocaine, heroin, and you start smelling, and somebody can easily perceive that, oh, this person is smelling. It can be even as a result of alcohol. You might have heard people say, oh, he's reeking of alcohol. He's reeking of alcohol. She's reeking of alcohol. So all those illegal drugs also can make someone to feel, people to start perceiving body odor around you. And apart from that, it can be as a result of some skin infections. We have some skin infection that can make someone to start smelling. and be having unpleasant body odor. And of course, it might be as a result of genetics, your gene. It runs in the family, is in your gene, is in your blood. You know, genetics, the DNA is what we represent. This is what we represent. Our gene is the genetics. So if my father or my mother had issue with body odor, it is possible for me too to have issues with body odor. You understand? So, and apart from that, it can be as a result of what we call athlete food. You know, athlete food is a yeast or a fungal infection to say. If you don't tidy up with athlete food, especially when you wear your shoes and immediately you remove the shoes, your shoes where people are, they want to run because the odors might send somebody packing. You understand? The odor might send somebody packing. So athlete food is one of the things that can cause it. And of course, lung infections can cause it. And when we're talking about this lung infection is not uh, something that you have to joke with. It can be like pneumonia. When somebody has pneumonia, at times, even in the hospital, you see when they bring the children, the nostrils are smelling. You understand? The nostrils are smelling. So it can be as a result of uh, lungs infection. And when we're talking about lungs infection, the one that is very common is your pneumonia. So if you're having any chest infection, you have this cough, you are having issues with your breathing and you don't understand, or your child has, it is appropriate to take he or she to the hospital. And if you are the one going through such, it is advisable you go to the hospital. It's not all the time that you'll be doing self medications, right? And of course, it can be as a result of autoimmune disorder. When we're talking about autoimmune disorder, it's just a disease condition whereby the body, the cells or the tissues of the body, for example, let's say my hand, the tissues of this place begin to attack the tissues of this my hand. You understand? Like somebody fighting against itself. You're fighting against your body. So that's an autoimmune disorder. For example, like lupus. It's a disorder we call lupus. If somebody has lupus, most of the time they can come down with body odor. If somebody has rheumatoid arthritis, you understand, they are both under autoimmune disorder. The body attacking its own tissue, attacking its own cells. So when it happens like that, you find out that such a person can come down with what we call body odor. It can be as a result of improper personal hygiene. If your boxers or your pants or your bra, your undies are not properly washed, or you are the type that can wear your bra or your panties for like 3, 4, 5 days, you see that it's not. It's a time you enter a bus or you enter a bike and you see that the driver of that bus is smelling. Not that they are dirty actually, but that their dress has not been washed for like days. You understand? And if it's like that, the body odor will. At times you might not be able to. At times you feel like you are choking when you are with them, like you are literally you want to pass out. Especially in the bus when you see some people raise their armpit like this. It is very very terrible. Then under the hygiene, we're still going to be talking about your armpit. If your armpit is not properly clear, because most of the times our hands are not most of the time raised up, it's usually down. And when it is down, there is no much aeration, fresh air coming underneath your armpit, except maybe you want to decide to. So most like 24 hours a day, your armpit might be throughout the day might be down, no fresh air coming into your armpit. So for some people, you see them leave the air. If you want to be natural, you want to leave your armpit or you want to leave auxiliary hairs under your armpit, you have to be able to have first class hygiene habits. If not, as soon as people meet you, your armpits odor will just emit and people want to They don't want to get close to you. I've been in a school with someone that I give I used to give her, you know, miles. I don't want to get closer to her because the body odor was shocking. So if you know you cannot keep ears here and be hygienic with it, it is better to get it off. You understand? So when you get it off, your armpit seems fresh and you're able to touch, you're able to, put powder or something so that the place will remain dry. And of course, apart from that, it can be as a result of pregnancy for women. If a woman is pregnant, we have various hormones that is coming to play when a woman is pregnant. There are some hormones that was there, they were there for menstruation, they were there for this, they were there for that, they have been there. But this time around now, you are pregnant. There are a lot of hormone coming to play to be able to pull you and your born baby through. So sometimes you see women, pregnant women, coming down with body odor. It can be as a result of menstruation, during menstruation too. You see women coming down with various body odor that are unpleasant. We are not talking about the normal body odor now. So we are talking about the unpleasant body odor, just like the way we said yesterday, unpleasant mouth odor. Do you understand? It can be a result of menopause. Menopause in women is just a point that menstruation activity stops. Menstrual activity. Menstrual activity stops. And when they stop, we call it menopause. For male, we call it andropause. So, but in women, as soon as you reach menopause, there is a stoppage of your menstruation. And the hormones that were helping you have the issue to maintain your skin, maintain your body, there is declination. They are in almost, going into extinction. And as that time, if you're not careful, too, if you don't know how to properly manage your hygiene, you can come down with various body odor. And of course, it might be as a result of hyperhidrosis. Talking about hyperhidrosis is excessive sweating. Some people have issues with sweat. Some people sweat normally, that is not either too much or too small. Some people sweat just uh, moderately, or some people don't even sweat. I've seen people who doesn't sweat at all. And they'll be asking questions, are they okay? Are they okay? But I've seen people that even inside AC, air conditioner, there's this sweat. If the weather is cold, they are still sweating. You understand? It might be but your body odor might be as a result of that. It might be as a result of your diet. If you are the type that eats cabbage a lot, you eat your broccoli a lot, you eat cauliflower a lot, you eat garlic a lot, especially people that choose garlic. Some people might not like me. I can't stand the odor of garlic. Cannot stand the broccoli, garlic, cauliflower, cabbage, and all that. They are some of the things that they have strong smell that can, make someone to have bad body odor. Then it can be as a result of sweat and bacteria. You understand? You have natural sweat. Then there are some bacteria in our body. They are just the normal bacteria. You understand? So when these bacteria now, when they now mix together with the sweat, the normal sweat that has, gone out of my body, I might start smelling if I don't take care of myself on time. It might be as a result of hygiene. How can a lady say, okay, my bra, I want to wear it. You wear it today, you wear it tomorrow, you wear it on Wednesday, wear it on Thursday, and you are wearing it for like a week. There's no how, because part of your bra will come in contact with your armpit to the right and to the left, and start seeing dirt, and they start smelling. Or your pants, you're washing it. Pants for a lady, your pants should be washed you should change your pants every day. We're talking about how we can cope, how we can prevent, or the remedies for body odor. But let's talk straight. about the causes was. It can be as a result of obesity. If somebody is too fat, you understand, you are overweight, you are fat, it can be severe obesity, it can be moderate, it can be mild obesity. Some of them might not be able to clean properly the way a slimmer person would. You understand? You understand? Most of them are even, some of them are lazy to even take care of them, like take care of their health like that, to properly bathe. Then it can be as a result of hot weather. When the weather is hot, there is tendency of someone to come down with body odor. So those are not like that cause, like exercise. It can be as a sort of exercise, like exercises and hot weather. They are not the cause that will be permanent most of the time. Maybe if I do exercise on Monday, those period before I clean up, body odor might come that might not be pleasant. Okay, maybe there is hot weather today, there is no hot weather tomorrow. Those ones are just, like transitional in nature. They're just coming, and of course, with or without much intervention, you will be okay about it. It can be as a result of some medical conditions like diabetes. Somebody that has diabetes, there'll be sweet smell, fruity smell, like we call it ketones. And when it happens like that, you start noticing as if they are leaking sweet. That's what you start noticing with them. And most of the time, if it's somebody with a thyroid problem, there will be increased metabolism. You understand? There will be increased metabolism. And if it's kidney disease, there will be fishy smell because of kidney fishy smell, because there's something we call urea in the kidney. There will be build-up of urea, and we call it uremia. That is urea, build-up of urea from kidney inside your body. You understand? So that is one of the things. And it can be as a result of certain skin infection. There's some skin infection that you will have, that when you have them, is a no, no, no. If you have that some skin infection, your body will naturally smell. There will be odor everywhere. It might be as a result of medication. My medications might even be doctors prescribed prescription drugs that can still give you that. So if you are using any drug and you are noticing any abnormality as other material time, it is time to get to see your doctor. And of course, it can be as a result of vaginal infection. There are some people, they call something toilet infection, toilet infection. They are actually yeast infection. You understand? It can happen to a man, it can happen to a woman. Now, if you have yeast infection or any vaginal infection or even sexually transmitted infection, and you are not taking care of it, you understand, it is possible for you to get to somewhere and people are running away from you that you are smelling. It can be as a result of menstruation itself, because of various hormones that are released during menstruation. You can calm down body odor. And it can be as a result of puberty. Puberty, before we get to age of puberty, especially when you are entering the young adult, teenage, preteen age or something, all those hormones have been there. They have been inactive. They have not started working. Now, by the time you are getting to preteen, early teenage age, or the young adult, you are gradually going into puberty. So as soon as you are entering puberty, there are some hormones that will become active. They have been sleeping, they have been dormant, or those are things. But now they are now coming into play. And most of them, because of the upsurge, they are coming like that. You start noticing that if you have a child that is just entering puberty, you just notice that they start smelling, and you are like, I had a girl staying with me the other time. And when she entered puberty, I was like trying to educate her how to take care of her body, buy roll on this. And she said, but I used to wash that my body doesn't smell. And I told her I had to, tutor her that no, it is not like that. If you are staying with me and you are coming towards my side, and I'm trying to hold or seize my breath because you are coming to me, it means something is wrong. So I had to, like tell her this and this and this so that she'll be able to understand me in a layman's term. It can be as a result of autoimmune disease when the body starts fighting against itself, the cells of a particular place, they start fighting against themselves. And of course, it can be as a result of toxin poisoning. That's toxin. Maybe there's something we call cyanide, all these chemicals, cyanide. Some people can ingest cyanide, or maybe the kind of environment you are working, you understand? And you have been working over there a month, 2 months, 3 months, and you are there. You understand? Your body can start smelling because those things, if you are not properly protected in that kind of environment, they can start entering into your body system and be giving off bad and unpleasant body odor. It can be as a sort of arsenic. There's another poisonous substances we call arsenic. Arsenic too, maybe the kind of company you are working or the environment you are living. Like in Nigeria, we have there is a place we have. Uh, Ideally, they're supposed to be residential area strictly for people. But in my own country, Nigeria, you will see factory that are producing cement. You will see factory that are giving off that their end products are giving off various bad chemicals built within the residential area. Or you see residential area going there to build out because the rules and the laws are not actually working. Everybody just do their own thing. There is lawlessness in the country that I reside. A lot of lawlessness. We take a lot of things for granted. We don't too much care about lives like that. So, because ideally, somebody produces cement that you are giving off maybe asbestos, you are giving off alkaline, giving off arsenic, cyanide, a lot of things. They are not supposed to be within the residential area. And all these things that they are entering the body, apart from the fact that they can even give somebody body odor, they can shut down your liver, shut down your kidney, shut down your heart, shut down your brain, shut down your lungs, and eventually make somebody becomes useless to him or herself. It can be as a result of pregnancy. During pregnancy, various hormones comes into play, and when they come into play, what happens? You might come down with what we call unpleasant body odor. It might be as a result of tuberculosis. When we're talking about tuberculosis, there is a particular bacteria. It's a bacteria infection, and what does it do? When he enters either through the mouth or the nose, is airborne, and when he enters, and you can get it for somebody if they cough. You understand? And if you don't pick it on time, it will just ingress into the lung and begin to deal with the lungs. You understand? And the side effect at times tuberculosis can spoil the spine. There is TB spine. And it's not as if the TB goes straight into the spine. It first comes to the lung, finish and just go and be going all over the body, wherever it stays. That's the problem. And it will degenerate and make sure that the spine bones, it degenerate it, finish it, and wreck it. You also understand. So when some people they have tuberculosis, especially when it's not properly taken care of, or when it is not caught on time, they can start having body odor. Then, of course, people with cancers, especially when the cancer is now advanced cancer. There are cancers in a particular stage that you start noticing the people that has it, they start smelling. Understand? They have unwanted, unpleasant, unwanted body odor. Then let's talk about the places that smells in the body a lot. So one of the places, and then apart from that, I remember something. There's something we call urinary tract infection. The urinary tract is where the urine comes out. The female has it, the male has it. But in the male, the urinary tract we call something urethra in the male reproductive system. That urethra, when the urine is coming, jeje, and is given to the urethra, the urine will pass through the urethra to the outer part. When the sperm is coming, it's still coming out from the same urethra. So the same opening is responsible for urine and sperm passageway in male's body system. But female, we have different vaginal opening, which is for sex, and we have another place which we call urethral opening that our urine comes out from. So it's not the same thing. Like if I want to give a male patient catheterization, if I want to catheterize a male patient, I will have to catheterize him on the penis. But in a woman, I will not catheterize her vagina, I will catheterize her urethral opening, which leads to where the bladder is directly for urine to come out. But the vagina will be left there, either for menstruation, for sex, for childbirth. You understand? So if there is a urinary tract infection, that tract that carries the urine, if there is an infection there, there can be problem. If there is athlete foot, you see some men, you are in or some women, if they have uh, athlete foot, you understand? Immediately they remove their socks and their shoes, and you are with them in an enclosure. The odor might want to kill you, might want to shock you, might want to shock you. You understand? Might want to shock you. So, and at times, if you have athlete foot and you are still wearing socks and you are not aerating your socks, you are not washing them, or you are not aerating your shoes, if you come and you know that your shoe is smelling, just go and aerate them, put them in air, put them in sun, let them dry. Not that you just leave the socks inside the shoe and tomorrow you just polish it and you are going again. If people at home can talk, fine. If people at home cannot talk, when you get to the office, it won't get better. It will be worse. You understand? Then let's now talk about places in our body that is prone to this body odor, smelling, that can give you. Number one is within the ear canal. It smells. You understand? Even behind the ears, because there's some things in our body, we call them sebum. Sebum is the oil. You understand? It secretes oil to our body, like people that have oily faces. So you will see it like that. People that have oily faces. That is just behind your ears. Those are the places you should properly care for. Within the ear, just at the back of your ear. Then apart from that, another place that smells so much is the belly button. That is your navel. The belly button smells so much. It smells so much. Your belly button. So if you bow, it is important your belly button to be it is important you clean it very well. Your belly button smells, your ear, just ear the canal, then the back of your ear. Those are the area that smells. Then of course your mouth, it still contributes to part of body odor. Yesterday we treated mouth odor, fine. But today we're talking about body odor. So, and your mouth, if it's smelling, it's still part of your body. So those are some of the areas. Then of course your anus, you understand? You will see that between the two buttocks, this is your buttocks, this is the other side of your buttocks. The thin line between the two buttocks don't have access to much air, and it's always full of moisture, because it's either you wear pants, women will wear pants, we wear tights, we wear jeans, we still likewise men. So just from that thin line towards your anus usually smells. So it's a place you should endeavor on a daily basis, even more than once. You can clean it up with soap and water. And of course, your armpit is the main culprit here. After the mouth is the armpit. If your armpit is not properly cared for, you can come down with body odor, as in serious body odor that people will be running away from you. You see some people, when they wear white, maybe they have been wearing that white, and you see all these places, it looks so yellowish or brownish. It's because they are not taking proper care of their armpit. There is no how you'll be taking care, and somebody will be seeing colored stain underneath your armpit. It's disgusting. Very, very disgusting. Then around your groin area, just by your, before the two thighs, there's a place we call groin. So those areas too, there is a lot of oil, and that place too is not being exposed to fresh air. The way your face will smell, because it's exposed, and your skin, your hands will smell, it's not the same thing. It's not the same way. The mid part of your anus, between your two buttocks, that tiny area that leads to your anus, is not the same way that it will smell. The way your armpit will smell is not the same way your skin, or your face will smell. The way you're growing as a woman or a man will smell is not the same thing, because already you wore pants, you wore ties, you wore jeans, and Thomas of us will still talking, and it will cover everything. So there is no fresh air really coming in, and there will be moisture everywhere, and bacteria likes to stay inside moisture. Like where there is water, there is no dryness. That's where they can incubate. That's where they can thrive. They can survive. And you see different bacteria inhabiting in that place, and they are mixing up with the bacteria, maybe from your anus that is not properly cleaned, and there will be odor that is serious around that area. And of course, it can be due to men that are uncircumcised. If you are an uncircumcised male, the chances are that, because the prepuce, we call something prepuce, that's the thing covering your penis as a man that is not removed, that is not circumcised, there will be accumulation of fluid, and bacteria inside that place we call prepuce, that thing they remove from the penis, that we call you, and then we say they want to circumcise, that thing they remove when they are circumcising. If you are an uncircumcised male, there will be accumulation of fluid and bacteria and sweat underneath that place, and is smelling. Usually it has this bad odor. There's something we call smegma. There'll be formation of smegma because of the bacteria and fluid build up. At times you see the place coming down with various smells, and it can be, of course, in the vagina. A vagina has, even when you are not menstruating, when you are menstruating, there might be odor. During ovulation, there might be odor. Even when you are not going through, there's no ovulation, there's no menstruation, a woman can still come down with vagina odor, which is normal vagina odor. When the uterus is there, we have a lot of chemicals, a lot of bacteria, the abnormal bacteria inside the uterus. They will help us to clean inside the uterus. So when they finish cleaning inside the uterus, they will now push it through what we call the cervix. When the cervix picks it up, the cervix opens up. The cervix is just like a door between the female uterus and the female vagina. So the cervix opens up. Cervix opens when we're about to give birth. It opens when we are about to have sex. Immediately the man pushes their penis, it opens up. It opens up when they want to give birth, and you hear the nurses or the midwife saying 2 centimeter. There will be, there's something we call vagina examination. We put our hand. So if I put one hand in that cervix, it represents 2 centimeter. By the time I put 2 fingers, representing 4 centimeters. By the time I put 5, I'm able to put 5 fingers. It means that the head of the baby is ready to engage and the baby will be born. So when the body now, when all those bacteria that are there and the hormones cleaning inside our uterus, when they clean it, what do? They push it out through the cervix. And when they push it out through the cervix, straight, they are coming into the vagina. So if you are now experiencing such every day and you are not cleaning up, not cleaning with soap, there's something we call douching. If you use soap to be cleaning your cervix, you can come down with cancer. So we don't douche, we just rinse. We use water to rinse. Even if you're having maybe sexually transmitted infection or any vaginal yeast infection or anything they call toilet disease or fungal disease of the vagina, you don't need soap at all, because most of these soap are scented, and all this scent, this phenol, all this acrolein they will add, it can, of course, give the cervix a whole lot of issues. So just use water and just clean. So we are still talking about the places that smell in our body. And apart from that, it can be your in between the web of your feet. You understand? You know, our feet too has 5 fingers. So 5 fingers in your toes. So when you have 5 fingers and there are webs, so don't just bath in the morning and say, I've bathed, I've bathed. You must be able to bath and clean. When you are bathing, clean all the webs, the digits, clean the digits, clean in between them. Even according to WHO now, when you want to wash your hands, you have to clean. Use the left hand to clean in between the digits, something like that, and use this to clean in between the other digits. Do you understand? And apart from that, your mouth and your throat has to be properly cared for. Your mouth and your throat has to be properly cared for. Because if you don't care for it, it will be smelling. Those are some of the places that smells in our body system. So by and large, we've been able to talk about the various causes of body odors and all the areas that smells in our body. So when we meet next time, we'll be able to discuss what we call the remedies for body odors. Till I come your way next time, I'm your friend, No Solution. Do have a great time and bye bye for now.